Hello, I wanted to first start off saying thank you very much for taking the time out of your day to watch my video and for leaving any feedback. Anything is greatly appreciated. Um, I wanted to inform you guys about preeclampsia because I feel as though many people don't know about it, and it's not big within the pregnancy community because only about 6% of pregnant women end up with preeclampsia, I apologize. I didn't even know about it personally myself until my sister was diagnosed with preeclampsia. So that's when I started doing a lot more research on it and just really realizing that a lot of women don't know about it. And I think that it's important if you have family members or just friends or anybody that you know that may be pregnant to just talk to them and see how you can help and how they can get tested and get this monitored as fast as they can. What causes a preeclampsia? A lot of people may ask. There's not an underlying cause of preeclampsia. Medical professionals at this point are not sure what causes preeclampsia. They do know, however, that women who live in high altitude areas are prone to preeclampsia. They will experience preeclampsia. Women that are from certain ethnic groups, such as African American women, Latin women, Filipinos, Caribbean women, those ethnic groups. There are some first signs of preeclampsia to look for. High blood pressure is the biggest one, is the first one that most medical professionals look at when your blood pressure is at about 140/90. High levels of protein in your urine. If your protein level is at about a 3.4, you have preeclampsia. So those are the kind of first signs that they look at. And also you yourself as a pregnant woman or whoever maybe keeping in contact with a pregnant woman or knowing a pregnant woman, and you'd be able to tell, okay, first signs, high blood pressure. So let's start monitoring what is gonna happen next because this disease is very, very serious. Symptoms of preeclampsia: you'll have your ankle swelling, your blurred vision. When my sister was pregnant, she actually saw stars. You will faint. She fainted a few times. Pain right below the rib cages. You'll have your kidney malfunctions, your liver malfunctions, severe headaches. These are very, very, very important symptoms to know and to kind of be, so that you're able to pinpoint them. If you do know somebody, or if you are pregnant, you'll be able to say, okay, I have these symptoms. I need to start monitoring myself, or I need to figure out a way to get this monitored or get some help before it does eventually get worse. Some of the risk factors, like as far as women that, will that are more prone to preeclampsia, again, will be if you have diabetes in your family. That's something to think about, that you may experience preeclampsia. If you are obese, that you may experience preeclampsia. If you've had multiple pregnancies, like if you had maybe 10 years apart, you had a kid now and then 10 years later you have another kid, but your second one will give you preeclampsia. Some first-time moms often sometimes end up with preeclampsia. First-time moms, yeah. So those are some of the risk factors for preeclampsia. Rolling into treatment. To treat the high blood pressure, you would get high blood pressure medication. Sometimes it will give you magnesium sulfate. The magnesium sulfate is in case you have severe preeclampsia, so that it doesn't roll into eclampsia, because eclampsia is a whole nother factor that leads to possible death. So the blood pressure medication and the magnesium sulfate are what they will usually give patients. There's no true treatment for preeclampsia. The best and pretty much the only treatment for preeclampsia is delivery of the baby via C-section or an induced labor. Complications that can occur with preeclampsia if a woman does not, in fact, take the proper steps to get monitored. You could end up with ischemic stroke. You could have HELP syndromes and acute respiratory syndromes. And these are not things to take very, very lightly. And it's very, very important to make sure that you're up on your stuff and, just being all the way well-rounded as far as things like this. Preeclampsia has no known cause and can lead to death if it's not treated right away, because it would turn into eclampsia. I'm Sydney Bala, and I chose this specific topic because, as I stated before in the beginning, my sister did in fact have preeclampsia. She wasn't, however, diagnosed until she was about 39 weeks, because preeclampsia can sometimes mimic certain other illnesses such as autoimmune disease or chronic illnesses, and most medical professionals won't really know it's preeclampsia until about 20 weeks. But I guess with her case, even then, they were just kept telling her she was dehydrated, because it was just, again, it can mimic other symptoms for other illnesses. And it wasn't until she was 39 weeks and ended up having to be induced that they realized that she did in fact have preeclampsia. And she spent maybe about almost a week in the hospital because it was a lot. And I just want people to please take care of themselves, and to please feel free to do more research on your own, so that you're able to stay informed, stay up to date. And if you know people that are women that are pregnant, or if you yourself are pregnant, please take care of yourself. And if you experience any of these symptoms, just make sure you reach out to a healthcare professional and make sure you take care of yourself. Thank you. Bye-bye.